Okay, thank you, Mr. Remy. Community Health Foundation is an English or Korean?
Yeah, you can mix up if you feel like.
Community Health Foundation, a non-profit organization established in USA and Sierra Leone. It's about 4 years since the formation of Community Health Foundation from 2020 in Sierra Leone, and in US is 2019. Yes. So over the years it's a non-profit organization. Over the years, we've been donating medical equipment and supply in Sierra Leone from USA, and also, sorry,
yes, right, also.
Yeah, and also we've been donating medical equipment and supply through the Ministry of Health, and also around Malentuan area to healthcare facilities until 2022, we were able to establish a maternal and child health hospital in Malentuan. However, it's focused on maternal and child health, but due to lack of another healthcare facility, we still have to provide healthcare services to all population. So until last June, I was able to meet with some doctors in the USA, and we started medical mission. So now we have a team of doctors formed by Community Health Foundation to be coming to Sierra Leone to provide free healthcare, including surgeries, minor and major surgeries, which we started last June, and the second one just completed, and it was successful. We were able to treat a lot of people, including eye care and dental and all medical complications so far.
Right.
Yeah, thank you for that. So, sorry.
Yeah,
so the hospital, the facility, the way we get there, because one thing will be the struggle for now the community over the years, they don't been get any hospital there where they provide surgeries. For example, the reason why I focus on maternal and child health, because when woman they be the day into labor, then get complication. No hospital not there around where we will do C-section for pull the picking out. Pass then travel go all the way to Magboka. And Magboka from Malentuan to Magboka is about 3 hours drive in normal road. But the road really, really bad. So during the rainy season, the motorcar is stuck on a road. Sometimes it's impossible to cross. So most times they lost the mommy and the pikin. So when we opened that hospital, one thing we focus on provide a theater, operating theater, and expert doctors, international doctors, where they do all kind of operation, including C-section. Yeah. So that now one thing we get there 24/7. The hospital they run 24 hours. The doctors then stay at the staff quarter in the hospital, so they're always available. We have a very good team of doctors and nurses. And the other thing we get, which is very unique, is a blood bank. We get a blood bank unit because when we talk about maternal and child health, women, they lost blood, even during the surgery. Sometimes they lost a lot of blood and they need transfusion. Or even when women, they deliver naturally, but still they lose blood. It go still need blood transfusion. So that now one thing we're happy about for the fact that we get a functional blood bank. We encourage the community to donate blood. We always get blood in our bank. So when people come, we test them and make sure if the blood match, we give them at no cost, especially on maternal and child health. And even when they come do the medical mission, the doctors, all man, they donate. So as I'm talking to you, we blood them all inside the blood bank. We don't donate, put on reserve for doctors then. That's now one thing. So we get a well-equipped lab. Also, we get a well-equipped laboratory. Because one thing the most challenges we face in this country is poor diagnostics. Yeah, especially in that part of the world, in the country, Malentuan, Tonkolele district, we not get a proper diagnostic center there. So in the hospital, we lab is really equipped, and it's been managed by a lab scientist in Minnesota, USA. So yeah, so we do a lot of tests. We do full blood count and everything before we treat. For example, patient will just can say me that and we give them malaria medicine. We test for nothing cause the headache. So that now one thing we get. And we also get a functional pharmacy where they import drugs then from USA, and we get drugs then from India, Turkey, and we buy some the way we need for get Nayasu. So we know they tell we patient if we go buy medication as street. We make sure say we pharmacy always equipped and provide supply and medication. That's now other thing. And also the environment is conducive.
Yeah.
We get 24 hours light. We build our own solar system from scratch. So when they get 24 hours light, we make sure say our patient and workers are comfortable. We get internet, we get CCTV camera for security reasons. So if they come far away, we don't see you for prevent, you know, people the way they come for can cause havoc in the place or thief and all that thing. So the environment is clean. We get water where they run 24 hours from a borehole and all that. So basically, that's where. Yeah. So from where we start the hospital, even before we start safe, we be done they do medical mission. We go to them village them, where they provide free medication to people in the village, Bele woman them, Kumra them, and even other population. We always partner with the Ministry of Health. We go do eye check, eye care, and all that. But since we opened the hospital 2022 to now, so far we always provide free health care to pregnant women, lactating mothers, and children who are under the age of 5, and that is still going on, 24 hours a day, 7 days a week. So, of course, other population who do not fall under the free healthcare category, we ask them for cost recovery, but our goal is to save life. So whether you have money or not, we prioritize life first. When you come to the hospital, we treat you regardless, whether you have money or not, we'll still treat you. But if you are not under the free healthcare category, we will tell you, say, this now for pay, if you can afford. If not, hey, our goal is to save life. So that's what we're doing. Yeah, so the doctors they work out with from US, they are practicing doctors. We get different specialties, including an OBGYN, which is our focus on maternal and child health. So now that's in there for. And we get, of course, the general surgeon from Nigeria, where in also the hospital all the time. And we get a family medical practitioner. We get a midwife. We get different specialties. Then one remember all right now. So yeah, and the collaboration also in the country with the Ministry of Health, will be able to get the dentist from Connaught. His name is Dr. Tula. He studied in one of the countries out of Sierra Leone, but he currently practices in Connaught. He's a volunteer in time, and another lady we name Miss Hannah. So then they provide dental care. Then they pull teeth, then they fill in teeth, clean and all that, all at no cost. And also the Magboka Government Hospital provided an ophthalmologist, the guy for the eye. INSEF can provide in service. So we provide eye care as well. So yeah. The collaboration with the Ministry of Health has been great over the years. We started by when we begin for send container of medical equipment, they donate through them, then they can go to their hospital them. Then from then begin give you duty waiver. So when we ship container for medical equipment, we know they pay, then they give you a duty free. We only they pay third-party charges like taxes. So that is really something we appreciate over the years, and it's still going on. And even recently, on the medical mission, they support the director for malaria control program, Dr. Falama, send medication there for malaria at no cost, and they test them, the additives, the way they do for test for malaria, for support we know about the medical mission, which is really, really beautiful. And it save we money because now they buy medication. So for let even give it that support, it's through the Ministry of Health, and we appreciate them. So the whole team, now Ministry of Health, we don't support we appreciate them basically. The feeling is great. Actually, the hospital is not only limited to Malantiwan. In fact, we get people that come from Guinea, where can they from this medical mission because of the kind care what they provide in the community. We get some Flamande in the Malantiwan area. We're calling people in Guinea. Even from the previous medical mission, we had patients from there. And Liberia as well this time back. So it's not limited to the Malantian community. We get we see all man in the country. It's open to the whole country. Besides, people they come on Freetown and different parts of the country, they go to Malantian because of the kind services they provide and the kind way how most of it is free, and even the one way they pay little. For example, like if somebody go there for annual operation, if Freetown, according to my research, the minimum what they pay is from 50 million. Yeah, and 1,500,000 surgery, and what they do, quick,
perfect, yeah.
All kind of operation. Prostatectomy is one of the difficult surgery. Then way over the years, I don't see it's very difficult for doing a sago. When man get enlarged prostate, because most times after age 40, man then they at risk for get that enlarged prostate. But over the years, when people then get her, then they only put what we call super PB catheter. Then they put her inside, then under the belly, now they the urine they pass. Salon, they call them blockage, but now enlarged prostate. So that's now one of the difficult surgeries that women don't see. Say it's almost impossible for doing a salon. But now we hospital they do them within trickle of an eye, and it way cheaper.